Hi there, and welcome back to American Society of the University of Haifa's weekly COVID-19 update with Dr. Manfred Green, Director of University of Haifa's International Master's Program in Public Health. Please be sure to tune in Mondays at 9 a.m. Eastern Time to hear Dr. Green's weekly update and be on the lookout for our latest briefings that we've been hosting with a range of professors at the university across different fields, all live here on our Facebook page. So Dr. Green, there's a lot to talk about in the realm of COVID-19 since our last catch-up. Israel and a number of US states are seeing a resurgence of COVID-19 cases since reopening for business. Does this mean, in your estimation, that the reopenings have occurred too soon?
Hi, Jake. Thanks very much. And I'm pleased to be back with everybody today. I'd like to put it into kind of a context. I think we need to look at what we're defining as our end result, our end game. And I don't know that any of us really know what it's going to be, or not, and not just know what it's going to be, but know exactly how we would like to be. I mean, you might argue we all want that virus to go away, but realistically, the virus is not going to go away for a long time. So what is happening is that we are putting into place a lot of restrictions, and some more successful than others, and I'll mention a couple. And then I guess in a way we're surprised when we lift the restrictions that the cases start to appear again, when in a sense we shouldn't really be surprised at that. So let me just give you the example. Interesting enough, I'd like to take the example of New York, because New York was one of the states where they really had a bad situation. I think they even said themselves, they were one of the worst in the United States and virtually one of the worst in the world. They had a very, very, very bad and large outbreak or epidemic, and with a lot of mortality, a lot of people died and so on. And they took upon themselves through the state government to really fight in the way they best they could to control that pandemic. And they introduced the restrictions, and they asked people to wear masks, and all the things that they've done. And I think I found it very impressive that the governor, Andrew Cuomo, appeared every day and gave this kind of update and reinforced this kind of thinking. And the results, I think, are very impressive. New York now is not only the lowest in the US, so it's one of the lowest anywhere. They virtually have no deaths anymore and very few cases. That's for New York State. On the other hand, there's states in the United States who've gone the other way. Like, you probably know, Florida, Georgia, states like that, and Israel. So now you say to yourself, well, the question obviously that you may want to ask me is what's going to happen now that New York then starts to relax the restriction? Because they've controlled it now, but then they're going to relax. So there again, I think we go back to your original question, how quickly you should do it. And I would agree with you that it should be a very gradual process. And the gradual process, not just to slow the outbreak, but to try and identify the weak spots. In other words, give yourself time to identify where we still have weak spots, and then try and get the epidemic to a level that can be controlled.
The head of the Israel Society for Infectious Diseases on Sunday wrote to the health ministry warning that the country was on the verge of, quote, losing control of the coronavirus pandemic. Would you agree with that assessment?
The increase in cases does suggest that, that somehow having brought it to a level that was very low and it's now gone up, I think, 400 cases a day or more. That's obviously a sign that the virus is spreading. And people will argue, but there are not many severe cases or there are not much mortality. But you can't really hide the fact that if you have many more cases at some stage, it's going to get into vulnerable populations and then have more severe cases and more mortality. So I think the question is, how did the government and did the ministries identify the weak spots, in other words, and actually introduce interventions very quickly where the weak spots are? And I think maybe to some extent, they didn't identify sufficiently the weak areas of where it was going. The other is, I still think that they haven't really managed to get the public to comply with what is really required And maybe because sometimes there may be mixed messages. And I've mentioned before, and I'll mention again, once again, I think that you have to have a very clear message, for example, about wearing masks. So if you're going to have a clear, but it must be something that can be complied with, can be implemented. So if you tell people wear masks everywhere, that's possibly not something that's practical. But if you tell them you must wear them at every stage when you enter a closed area, a supermarket or a theater, wherever you go, you must have a mask on. That gives a very clear message. And I think that that message should be much clearer. You know, what we really want and how clear it should be.
It's also been reported that many recovered COVID patients have been experiencing adverse effects after they recover from the virus. Have you seen any evidence of that?
You know, I can only mention anecdotal things that have come to me from colleagues, but I want to remind people that, you know, nothing is definite in medicine or biology, but this kind of information is very common when you have outbreaks or epidemics of a new disease. You know, and often that information is not very well based later on. In other words, you know, the impression that there'll be a lot of that, in other words, a large percentage of people will suffer side effects. We don't know what that means. What is large? 1%, 10%, 20%. So it's actually something that's very difficult to assess. But that's something that's being investigated right now. There are already research projects going on to follow up patients and to determine whether they have long-term effects. As I say, it's not impossible. It's a new virus, and it does give it affects most of the organs in the body virtually. So there may be, but I wouldn't at this stage say that it's an inevitable effect of the virus. I think it, you know, it may be a very small amount.
Mm-hmm. Mm-hmm. Would you describe the current situation as, you know, quote, the second wave of coronavirus, or have we not quite entered that yet? And are we still dealing with the first wave? And just kind of like, where do you think we go from here?
Let's go back again very briefly to what we think, what we know about pandemics generally, and spread of infectious diseases. The whole concept of a wave, a second wave, a third wave is often spoken about as if it's some kind of law and it's based on some kind. But in fact, you'll see different kinds of waves in different kinds of diseases at different times. And often the waves are actually not waves, but simply the same the virus that's spreading, and sometimes with more disease and sometimes with less. So, and of course, it's related very much to the behavior of the population. So obviously, if you're reducing restrictions, you might see an increase in cases. That doesn't mean, that's not a natural new wave. Excuse me, it's not because the virus has changed its behavior or that it actually, you know, something inherent about the virus. It's something, as I say, that can be expected. The virus is still around. If you think of the population as a very heterogeneous population, it's not the ideal kind of thing that you'd look at statistically of a completely homogeneous mixed population. You put a virus in and it'll spread in it. It's clusters of people. So the virus will affect clusters and will affect vulnerable people. At some stage, it may drop until it finds another cluster of vulnerable people. Then it comes up again. So there are a lot of factors that could be affected. Obviously, climate could come into it and so on. So I would say that what we're seeing right now is simply a reaction to the restriction, the lowering of restrictions. And you can call it a second wave because it's the cases are going up. But I think we need to distinguish it from a concept of a second wave, which seems to be something related to the behavior of the virus. It's not necessarily something inherent in this virus.
Mm-hmm. Mm-hmm. Do you envision Israel, going back into or putting in place more restrictions or going into another lockdown? Or does that, I mean, obviously that really just depends on the numbers. I assume that the government is not rushing to make those sort of decisions at this point though, right?
I think that this is the time, or maybe it should have been already, but this is certainly the time to look forward to the future and say, what do we see in the future? We hope there'll be a vaccine, and there'll be a vaccine that may be only partially effective. And I'll mention. So in other words, I think there has to be a plan as to how we can keep this pandemic in Israel at a low level that is not impacting too severely on the health services, not impacting too much on the health of people, not causing too much absenteeism from work, which is also an important thing. And we can open the economy, and if everybody got sick, then what would we do? They wouldn't be going to work. So we need to make this balance. And I think that this is where the restrictions will come in. I think things like wearing masks, certainly in closed spaces, the sort of distancing, avoiding crowds, and so on and so forth. These are things that the public can do without too much impact on the economy, but you have to get cooperation. And then again, you get, the other thing will be the vaccine. And I'll just say a couple of words about the vaccine. I don't know how much time, but you'll tell me, you'll give me the time limit.
Yep.
But there are very many vaccines under development, as you know. There are a couple of issues with vaccines. The vaccines generally, vaccines are almost never 100% effective. They always have a situation where some people who were vaccinated still got sick. So that happens even with the best vaccine. And they'll vary. For the flu vaccine, we may say it's only 50% effective or 60, or whatever, sometimes less. So only it's partial protection. So what do we do if a vaccine is available, let's say, at the end of the year? Be very optimistic, I say, although they talk about licensing something in September. I would guess not before the end of the year there'll be anything available. But it'll be available in limited quantities. And it'll also be probably a vaccine that's not going to be 100% effective. It may only be partially effective. So who do we vaccinate? Who are we giving the priority? And in this situation, probably one possibility, and I'm not saying it's the only one, would be not to vaccinate children, because they are not affected very much and they don't seem to be doing much in spreading. So let's say up to the age of 18 or whatever, not vaccinate. Vaccinate actually from 18 to 60. And you may say to me, well, why aren't you vaccinating the vulnerable people? Because they are the elderly. Well, the elderly actually don't usually respond that well to vaccines. You know, in general, they have a lower response. So if you're giving, let's say, as a flu vaccine, so if you're giving them as a priority, you may only get a very relatively small proportion of them actually immune, and the virus will be spreading widely. So maybe one possibility is to vaccinate the spreaders, that kind of 20 to 60, and in that sense, provide a level of protection to the elderly and also to the children in that sense. So I'm saying that our strategy, our vaccination strategy, is probably going to be somewhat different from the general vaccination strategies. And it'll have to be something that'll be tailored to this particular kind of situation.
It's very interesting. I know we've spoken about it in the past, and I know we've spoken about it a little bit on this conversation, but can you just remind our viewers, you know, how important masks are and the role that they play in containing the spread of the virus? In the US, you know, mask wearing requirements vary so much state by state, even sometimes within certain states. Even in Israel, it's there's now a new requirement, the requirement back to wear masks out. Can you just remind our viewers how important it is to wear a mask in the spread of this virus?
You have to go back again to why wearing masks has become almost a controversy. Why should it be a controversy? We know that people in medical situations, medical health workers, wear masks to protect themselves and often to protect the patients, but they do it. So people who are operating in the operating theater would be wearing masks to protect the patient, not to protect themselves.
Right.
But in the wards, if the people with infectious diseases, you would be wearing masks to protect yourself. So obviously we believe that masks are effective. Some good evidence in the literature, other evidence that's studied on trials or whatever, not just evidence that the actual mask prevents viruses or particles from passing through the mask. I'm talking about actually doing it in the field and saying people who wore masks got less sickness than those who didn't. And those are very difficult studies to do. So we don't have many studies that are really good in that area. So we left though with what appears to be common sense, very good common sense, and what seems to be technically and mechanically good evidence. I think where we made a mistake, we made a mistake in our messages to the public. We made a mistake in our messages to the public early on where we said in a sense that masks were not useful for the public. A lot of that messaging was because there was a shortage of masks. And the public were taking masks that needed, and we knew that there was a shortage of masks for healthcare workers. There was a sudden rush on masks, and they weren't producing masks rapidly enough. That was really a bad message. The bad message of saying that the masks are not useful for the public. That was, in retrospect, that was wrong. We should have actually been straight up front and say, let the health workers let them use their masks, and you'll get your masks later on, or whatever, but not say to them it's not useful for the public. So the public is now staying with that early message. Well, they don't know whether the mask is that good anyway. When in fact, I think that was a messaging error. And I think we should go back to how and when to wear the mask. We can talk about it, but I think it's almost common sense that if you wear masks, you're going to actually protect yourself to some level, and you're going to protect others to some level. So if you can already reduce that, you'll reduce the impact.
Yeah. Last question, and we're running a little short on time. So, but if you could say one or two specific steps that, national, state, city governments, even a country like Israel should be taking right now to curb the spread of COVID-19, what do you think? What would you say are one or two of the most important steps that governments can take at this particular junction?
I'm going to actually use this opportunity to go back to something I said sometime before, and what Elizabeth Kubler-Ross said about the 5 phases of dealing with grief, where you talk about the denial of something, then you have anger, then you have bargaining, and then you have depression, and then acceptance. So we've gone through the denial, and we've gone to some extent gone through the anger. And I think we're very much in the bargaining, depression sort of thing. And that is a very dangerous stage. And that's why governments have to recognize that the public and professionals, when you start this bargaining argument, maybe the virus is getting weaker, maybe it's not spreading as well, maybe there won't be a second wave, although there's no reason why there shouldn't be a second wave, or a third or a fourth. The virus is with us. So why shouldn't it come back? So as long as we keep going through this bargaining phase, we don't really get to the acceptance phase, which is the phase where you deal with it. So I think the most important thing, if you really ask me, more than just, masks, physical distancing, and avoiding large crowds, which I think would be the most important thing, I would say is very clear messages. Very clear, and messages that the public feel that they are able to comply with, and they understand why you're giving these messages. Good information, very good. And give them all the information that you have. Don't give the public the feeling that you are hiding information. You come up front and say, this is what I know, this is what I don't know, this is what we're doing with this information, and give this message to the public. And I think that I would say would be the most important thing.
Yeah, it's fascinating. Okay, well, thank you so much once again, Dr. Green, providing such important insight, and thank you to our viewers from around the world. As always, to our viewers, if you have any questions at all, please leave them in the comments section of this video, or email us at info@asuh.org. We'll reply as soon as we can. For more information on the University of Haifa's work around the pandemic and to support programs like the Masters in Public Health, please do find a link included in this post. Thanks once again, and we hope to see everyone soon.
Thank you, Jake. All the best.
Thank you, Dr. Green.